I'm Rachid Mohamed. I'm a gastroenterologist. I've been working in Calgary for the past 15 years. My areas of interest are primarily in pancreaticobiliary medicine as well as in tissue resection, although I see all aspects of gastroenterology practice. As specialists, we have some experience with communicating with primary care practitioners for advice through different platforms, but I have always found them to be somewhat inconvenient and cumbersome because it's often interrupting our days, or the questions that were being asked through those other platforms were just not ones that we could answer in a streamlined fashion. So with Alethea, I found that it was something that I could do a little bit more manageably throughout my day. And I found all of the questions to be quite reasonable and things that I could probably offer some pointed guidance and insight on. I think because it's a web-based platform and there isn't a specified time requirement, I find that I can do them fairly seamlessly throughout my day. If I'm in between patients or if there's some downtime during my procedure list, for example, I'll often just log on and see if there are a few to be done. Some of them I do toward the end of my day, but I've never really found it to interfere with the workflow of my day. Yeah, I think I get questions right across the board. I have many questions regarding, imaging investigations on a patient that may show something, symptoms such as reflux or diarrhea or abdominal pain, and even some hepatology questions that I get that I try to sort of answer to the best of my ability, not being a specific hepatologist. I typically try to turn them around within the day. So the day I receive them is when I try to answer them. Admittedly, it might spill into the next day, but I'm cognizant that my colleagues are often waiting for this to help direct and further the care of their patients. So I do try to turn it around within that day. Yeah, it's a really good question. And I actually had an opportunity to speak to one of the primary care practitioners who uses the Alethea platform about this very thing. Getting to see a gastroenterologist is really difficult, and we're very aware of that and fully cognizant of the fact that our wait time and our triage process is imperfect. But I think platforms like Alethea do allow our primary care practitioners to communicate to their patients that they have at least discussed their case or their symptoms with a specialist. So even though I'm not interacting directly with the patient, I think I'm empowering the primary care practitioner to say, the treatment plan that I have established for you has been reviewed with the specialist. They're on board, they're supportive of it. And I think that helps that relationship, that therapeutic relationship between the primary care practitioner and the patient. Thank you to Alethea for the format that you've developed and the hard work that you continue to put into helping this be a very meaningful and fruitful relationship between us and the primary care practitioners.